Hey everyone, and welcome to the channel. Today we're going to be talking about something really important, bipolar disorder. It's a mental health condition that affects millions of people around the world, and it can be really difficult to understand, both for those who live with it and those who don't. Now, I'm not an expert, but I've done a lot of research on this topic, and I think it's crucial that we talk about it openly and honestly. We're going to break down the different types of bipolar disorder, explore the symptoms, and look at the causes and treatment options available. It's important to remember that everyone's experience with mental health is unique, and this video is not a substitute for professional medical advice. But hopefully by learning more about bipolar disorder, we can help reduce the stigma surrounding mental illness and encourage more people to seek help if they need it. So let's get started. So let's start by talking about bipolar 1 disorder. This is what many people think of when they hear the term bipolar. It's characterized by intense mood swings that cycle between periods of extreme highs, known as manic episodes, and extreme lows, known as depressive episodes. Now, these aren't just your average good days and bad days. We're talking about significant shifts in mood and energy levels that can last for a week or more. During a manic episode, someone with bipolar I might feel euphoric, like they're on top of the world. They might have boundless energy, need less sleep, talk really fast, and jump from one idea to the next. They might also engage in risky behaviors like spending sprees, reckless driving, or substance abuse. On the flip side, during a depressive episode, someone with bipolar I might feel incredibly sad, hopeless, and lose interest in things they used to enjoy. They might have trouble sleeping or sleep too much, experience changes in appetite, and have difficulty concentrating. It's important to note that not everyone with bipolar 1 experiences these episodes in the same way. The severity, frequency, and duration of these episodes can vary greatly from person to person. Some people might experience more manic episodes than depressive episodes, while others might experience the opposite. And then there are those who experience what's called a mixed state, where they have symptoms of both mania and depression at the same time. This can be particularly challenging to manage. Living with bipolar I can be incredibly disruptive to a person's life. It can affect their relationships, their work, and their overall well-being, but the good news is that bipolar I is treatable. With the right combination of medication and therapy, people with bipolar I can manage their symptoms and live full and meaningful lives. Now, let's move on to bipolar 2 disorder. This type of bipolar disorder is often misunderstood because the highs aren't as extreme as in bipolar 1. Instead of full-blown manic episodes, people with bipolar 2 experience what are called hypomanic episodes. These episodes involve a distinct change in mood and energy levels, but they're not as intense or as long-lasting as manic episodes. During a hypomanic episode, someone with bipolar 2 might feel very productive, creative, and energized. They might have increased self-esteem and feel like they can accomplish anything. However, these periods of elevated mood are often followed by depressive episodes, which are a key feature of bipolar 2. These depressive episodes are similar to those experienced in bipolar 1, characterized by feelings of sadness, hopelessness, loss of interest, and changes in sleep and appetite. The thing about hypomania is that it can be tricky. While it might not seem as disruptive as mania, it can still lead to problems in relationships, work, and overall well-being. People experiencing hypomania might be more irritable, have difficulty concentrating, and engage in impulsive behaviors. And because the highs can feel good, some people with bipolar 2 might not even realize they're experiencing a hypomanic episode until they crash into a depressive episode. This is why it's so important to recognize the signs and symptoms of both hypomania and depression in bipolar 2. Early diagnosis and treatment can make a huge difference in managing the condition and preventing it from significantly impacting a person's life. Just like with bipolar 1, treatment for bipolar 2 typically involves a combination of medication and therapy. Medications can help stabilize mood and prevent extreme swings, while therapy can provide coping mechanisms, improve communication skills, and address any underlying issues that might be contributing to the condition. Now, we've talked about bipolar 1 and bipolar 2, but there's another type of bipolar disorder that often gets overlooked. Cyclothymic disorder, or cyclothymia. This is a long-term condition characterized by periods of hypomania and milder depressive symptoms. The key difference here is that the mood swings are less extreme than in bipolar 1 or 2, but they last for a longer period, typically for at least 2 years or more. Imagine a roller coaster that has gentler hills and dips, but keeps going for a really, really long time. That's kind of what cyclothymia can feel like. People with cyclothymia experience periods of feeling up and periods of feeling down, but these shifts aren't as intense or as disruptive as in other forms of bipolar disorder. They might go through weeks or months feeling happy, energized, and productive, followed by weeks or months feeling sad, withdrawn, and unmotivated. Because the symptoms of cyclothymia are often milder and less debilitating, many people with this condition may not seek professional help. They might think it's just their personality or that they're simply going through a rough patch, however. It's important to remember that even though the mood swings are less extreme, they can still have a significant impact on a person's life. Untreated cyclothymia can lead to relationship problems, difficulty at work or school, and an increased risk of developing bipolar 1 or 2 disorder later in life. If you or someone you know experiences chronic mood swings that seem to follow a pattern, it's important to talk to a mental health professional. Early diagnosis and treatment can help manage symptoms and improve quality of life. Just like with other forms of bipolar disorder, treatment for cyclothymia typically involves a combination of medication and therapy. Therapy can help individuals develop coping mechanisms for managing their mood swings, while medication can help stabilize mood and prevent the condition from progressing to a more severe form of bipolar disorder. So far, we've explored the 3 main types of bipolar disorder: bipolar 1, bipolar 2, and cyclothymia. But the world of mental health is rarely black and white, and bipolar disorder is no exception. There's a whole spectrum of experiences that fall under the umbrella of other specified bipolar and related disorders. These are diagnoses used when someone shows symptoms of bipolar disorder, but they don't quite fit the specific criteria for bipolar 1, 2, or cyclothymia. It's like a catch-all category for presentations that are a little more nuanced and complex. For instance, someone might experience rapid cycling, which means they have 4 or more mood episodes within a year, cycling between mania, hypomania, or depression at a dizzying pace. Imagine trying to keep up with a roller coaster that speeds up and changes direction constantly. That's what rapid cycling can feel like. Another example is bipolar disorder with mixed features. This is when someone experiences symptoms of both mania or hypomania and depression simultaneously. It's like having your wires crossed, feeling both incredibly energized and utterly hopeless at the same time. It can be incredibly confusing and distressing to experience. Then there's short-duration hypomanic episodes, where someone experiences hypomania for a shorter period than typically seen in bipolar 2. These episodes might last for a few days instead of a week or more, making them harder to recognize and diagnose. The important thing to remember about these other specified diagnoses is that they're just as valid and deserving of attention and treatment as the more well-known types of bipolar disorder. Just because someone's experience doesn't fit neatly into a box doesn't make it any less real or any less challenging to live with. If you're concerned that you or someone you know might be experiencing symptoms of bipolar disorder, it's crucial to reach out to a mental health professional. They can help determine the best course of action and connect you with the right resources and support. So that was a lot of information about a complex topic, but hopefully it helped shed some light on the different facets of bipolar disorder. If you're struggling with bipolar disorder or any other mental health condition, please know that you're not alone. There are resources available to help you navigate these challenges and find support. Remember, seeking help is a sign of strength, not weakness. Taking that first step towards understanding and managing your mental health can lead to a brighter and more fulfilling future. Thanks for watching, and we'll see you in the next video.